Mothers can now take their babies for shots of measles, BCG, and oral polio vaccines, which are now available in most district hospitals across the country. Now, for months, babies were turned away from vaccination because of a nationwide shortage and the uncertainty brought on by the lack of finances, which were faced by the Ministry of Health in purchasing drugs. Now, a number of health facilities since last Friday throughout the weekend have been taking stocks of vaccines which were procured by the ministry. Now, we will be touching base with some health directors to understand how the situation is now. But here is Dr. Patrick Kumar-Boaji, the Director General of the Ghana Health Service, announcing the arrival of vaccines at their various facilities for onward submission to the district.
The first batch of the vaccines just arrived, and we have doses in BCG, oral polio vaccine, and then the measles vaccine. They just arrived with the accessories, the syringes, safety boxes, they've all just arrived. And so immediately they are being dispatched to the regions, and then latest by Monday, vaccination will start across the country. We want to use this opportunity to assure all mothers that there will be enough vaccines for everybody. There's no rush. They should come and get the vaccine as they are due. So this is the 3 out of the 10 vaccines. We normally have 10 vaccines that are used for 13 diseases across Ghana. 3 of them were in short supply. That is the OPV, BCG, and the measles rubella vaccine. We have received quantities of the 3 to complement what we are doing. And this is the first batch that arrived. We are hoping that the rest will come in very soon. We are moving all the supplies to the regions and the facilities, and so by Monday morning, there will be vaccines available for those who need it. The doses that are available is enough for at least a minimum of 6 weeks across the country, whilst the others are brought in. So we have enough doses to cover our need for the next 6 weeks. We are moving to the cold room, and the regional cold vans are waiting to pick them up and quickly send them to the regions and to the facilities, so that by Monday, as I said, we would start vaccinating all. These new vaccines are just going to help us do a catch-up to make sure that by the end of the year, all children who are supposed to be vaccinated are vaccinated. And so, even though there's a delay for vaccination, the most important thing is that you will take them as and when they come. If you can't take them before the due date for the next booster, but the days after still doesn't really affect the immunity that's supposed to provide for you. And we also have heard rumors of people parading around with vaccines. Vaccines are not sold in the shops. They are not sold on the tabletop. So they have to be careful that people are not bringing in vaccines that are not of good quality. We have vaccines across the country now, and everybody should relax. Go to their point of care, and they will be all vaccinated.
So let's go to the regions now and find out what's happening. Let's start from the Volta region, where the Regional Health Director, Dr. Senanu Jokoto, joins live with more. Doc, I'm grateful that you could join us here. How many vaccines have you received, and what number of babies are you expecting to vaccinate?
Good morning to you and your listeners. We've received oral polio vaccines. We've also received vaccines for measles, yellow fever, and BCG as well as for meningitis. As soon as the vaccines touched ground in Accra, our Director General gave the order that we should all be at hand immediately to take it and distribute it to the various districts. So this morning, the exercise is ongoing, and we hope that all facilities within the region will get their vaccines.
Doc, sorry, we would want to hear you better. So if you could speak up a bit for us, we would appreciate it, sir.
Thank you very much. A very good morning to you and your listeners. Like I mentioned, the Director General gave us an order to ensure that all our cold vans are in Accra on Saturday so that immediately the vaccines start basing in the country, we are able to take it and distribute it to the rest of the regions. So we did exactly the same, and the process is ongoing in the Volta region. We are hoping that sometime during the day, all the facilities will have vaccines. So we've received vaccines that will be adequate enough to do the catch-up vaccination and also last us for the next 6 weeks. We are made to understand, and we believe so, that within the next couple of weeks we'll get vaccines in adequate supply to take care of the rest of the year.
So, as we speak, have we begun immunizing some children who needed the vaccines but couldn't because of the shortage?
We are telling them that by close of day, we should have all the vaccines in the various facilities. So today I've engaged quite a number of radio stations in the Volta region, and we've engaged our system that latest tomorrow morning, everybody who requires the vaccine should have it available.
Okay. So the numbers that we have in, how educated are they to ensure that we're able to give to every child that needs it?
We know the needs for the various districts, and we know the gaps, and we distributed it accordingly. So we know that at least for the next 4 to 6 weeks, we are in the position to provide the services that required.
All right. Grateful to Dr. Jokoto for joining us here. He is
Thank you very much.
Volta Regional Health Director. Let's now move to the Northern Region, where my colleague Martina Bugri is joining us. She's been monitoring the exercise in that part of the region and joins us with more. Martina, grateful. What can you tell us about the arrival of vaccines in the Northern Region? Okay, so we'll be touching base with Martina so we can understand whether or not the northern part of the country have also received their vaccines. The Director General makes us aware that every region is by today, should have access to these vaccines. We just heard there that the Volta Region Director confirming that they have received this. We'll be getting there later to tell you more about now. Let's come down to the Greater Accra region, where my colleague Hannah Odami has been visiting some health facilities for update. Hannah, where have you been to and what can you report? All right, so let's get some update from Martina now. Martina now joins us. Martina, what's the update? What do we know about vaccines arriving in the northern part of the country?
Yes, the vaccines, I'm told, arrived yesterday, and they have been received by the Ghana Health Service. But details of that is yet to be given to the media. I spoke with the acting regional director of health service this morning. He confirmed that they have received the vaccines and that they will take the stock this morning, and details of what they have received will be shared amongst us.
Aside speaking to the regional director, have you heard anything from the district to check whether or not they've also received them?
Yes, so I spoke to some people in the district. I'm told that they are yet to. They have sent people to come to the region for their share of the vaccines that have come in. But they are yet to get back to them. And so it means that they haven't started the distribution yet as we speak. But we are told that likely today they will start the distribution. But I've also been told that cases continue to pour in, and isolation center, if they want to actually accommodate people or admit people, they may not be able to contain the numbers. So what they are doing is they are treating people, and those that are not too serious, they are asking them to go home.
Which means that if there should be any vaccination at all, we should expect that would start tomorrow on Wednesday.
From what I checked, that's possible.
All right, Martina, grateful to you. Let's bring you to the Greater Accra region, where Hannah Odami has been visiting some health facilities for update. Hannah, where have you been to and what have you observed? Hannah, you've been touring some health facilities within the Greater Accra region to ascertain the latest on these vaccines. Where have you been to and what can you report?
I am touring currently at the Adabaka Polyclinic where I have seen some mothers bringing their children to be vaccinated. And the excitement on their faces alone tells us indeed they are very, very happy. The public health nurse here tells me that since a lot of them are not aware, they may not be coming. But you were shocked to see that this morning a lot of them have stood here already and they are excited. And so she's actually urging all of them to come over because the vaccines are now in. I asked her whether she has all the vaccines that were not seen previously, and she said that they are all in. And I'm going to talk to her right now. She's Patricia. Hello, Patricia. You earlier said that a lot of parents have been here. What exactly would you also want to tell them? A lot of parents have been here already.
Actually, I'll urge the parents try their best to look into any public facilities that are around, hospitals that are around. Since the vaccines are in, we are excited so that they'll be able to take the immunization to protect their kids.
And she's also saying that there's the greater effect, as we have heard a lot of doctors say already, there's greater effect if you do not get your child vaccinated. And so now that they are in, just come over. It's not too late to any health facility and get your child immunized. All the vaccines, I have seen them here. All the vaccines, she says, are in, and I have also seen them.
What have parents been telling you once you said that they are wearing some smiles on their faces? Have they been telling you anything?
So they were actually grateful to government, but then they said they don't want to experience this ever again because then the agitation and the anxiety that they felt within the period which they did not have the vaccine for their child was not good at all. One of them who didn't want to go on record told me that the last time she had a vaccine for her child was a year ago. And she's been coming here all the time for the second one. I really do not remember the name of that vaccine. But she'll be coming here for the second batch of that vaccination. And she was told the child that there was no vaccine. And so she was very afraid because she was told that the effect of this was the child easily contracted tuberculosis. Thankfully, for 1 year now, the child has not contracted. And so she quickly came here when she heard that the vaccines were in. And so they are telling and urging government that they do not ever want to experience this again. Another parent also told me that all she was told was that there was no syringe. The vaccines were in, but there was no syringe. She was shocked. The whole country does not have syringe, but then now today, all of them are in. And so, as we heard the public health nurse said earlier, we do every vaccine is in, and so the parents just come over and get their children vaccinated so that they do not have the complications associated with not having these vaccines.
All right, that's good news there. Thank you so much, Hannah Odame. So that's by way of vaccine availability in some health facilities. So they're moving on.